29. Right, okay. Shall we start? Okay, students, please welcome Kun Oho and Kun Ciaran to speak about vaccine tourism for us today. If you have any questions, again, feel free to ask. You can wave your hand or you can send your question through the message box, okay? Right. Good afternoon to you all.
Hello. Hello.
Good afternoon ค่ะ
Are you able to share your screen, Ciaran?
Unfortunately, the Wi-Fi in the hotel is gone, so I'm gonna just have to speak. So I'm using 3G off my phone onto my iPad.
Right. Yeah, you told me. What luck. It happens.
It's all gone completely pear-shaped. The Wi-Fi in the whole town went down about 1 hour ago. So, do you want me to begin now?
By lottery. Yeah, sure. I think if the students are ready, if Napu is ready.
Okay. Just to first introduce myself, my name is Ciaran McNeil, and I am the General Manager of Tui Blue Cowrack Resort and X10 Cowrack Resort. I'm also the host of the Thai Expat Daily Show, which is a commentary news podcast available on YouTube and various other players. I've been asked to talk with you today about vaccine tourism, reopening a resort after COVID, and the reopening of Thailand and the sandbox programs. So the first thing to talk about is, what is vaccine tourism? Vaccine tourism means visiting another country to get a vaccine not available to you in your home country. It's a relatively new concept brought about by the COVID-19 pandemic. Now, from reading and research, vaccine tourism kicked off back in December when an Indian travel agency announced that they were taking registrations of Indians with a valid 10-year US visa for their COVID-19 vaccine package, and a 4-day trip from Mumbai to New York City with a coronavirus shot included. The cost was $2,000 US. And this is, from my research, the beginning of vaccine tourism and when it started. Now, the pros and cons of vaccine tourism, there seems to be more cons than pros when you look at it. Now, the pros are that the person will be able to get a vaccine that's not available in his or her country. It will also kickstart tourism and travel in that respect. However, the cons of such tourism it further increases the divide between the wealthy and the less privileged in society. At the epidemiological level, traveling poses severe health risks, such as spreading the virus at the destination, as well as the country of origin after traveling. The phenomenon also highlights larger problems with the way vaccine distribution is handled in the international community. Despite some efforts to guarantee access to the vaccine to countries in the global south, rich countries are hoarding vaccine supplies to the point that Canada has ordered more than enough vaccines to vaccinate its entire population 5 times. This artificially creates scarcity, pushes people to try and get their hands on a shot by any means possible. Now, examples of countries that have been doing vaccine tourism. The first one that comes to mind is the Maldives. It's been offering COVID-19 vaccines for travelers in a bid to revive its tourism sector and thus its economy. That, I think, went back nearly as far as July last year. The Russian authorities are also offering COVID-19 vaccines for foreigners, though it's not for free. Travelers are now being offered vaccine plans lasting 3 weeks for foreign travelers, with prices ranging from $1,500 to $2,500, in addition to the cost of a flight. Abu Dhabi, another famous tourism destination, has been offering tourists holding entry visas free COVID-19 vaccines of Pfizer or Sinopharm. The resort island of Bali has started to offer China's Sinovac and the UK's AstraZeneca vaccine to tourists from abroad through packages that include vaccinations. The plan has been developed by the Tourism and Creative Economy Ministry in Indonesia. Now, people might ask, does Thailand do anything such as vaccine tourism? And the answer is no, and simply because the supply of vaccines in Thailand is not the same as in other parts of the world, so it's very difficult for them to do such a thing. Now, factors to consider for Thai people seeking to go abroad to get vaccinated. You have to think about first the entry requirements for the country that you plan to visit. Do you need a visa? Do you have to quarantine when you get there? Obviously, the cost of such a trip, it can be quite expensive. The length of time between doses. So if you go, for example, and you get Pfizer, I think it's 3 or 4 weeks between each dose. AstraZeneca is longer. So do you have the time to stay in the country to get your vaccine there? Then the entry requirements when you want to return to Thailand. Quarantine, sandbox, the length of time to be considered fully vaccinated as per the Thai regulations, which is normally 14 days after your second dose. And then, of course, the acceptance of the vaccine certificate that they give you in that country in Thailand. So will it be accepted when you get here? And, you know, these are things you have to balance out. Another thing, when we talk about vaccine tourism, and then obviously because my background is in the hotel industry, I'd like to talk a little bit about reopening of hotels during this period of time, okay? Because a lot of people think that, you know, with vaccines comes the return of tourism and you know, things like that. But it's not as simple as that anymore. The hotel industry has been one of the most affected sectors by COVID-19. Unlike other businesses that can operate remotely, like you can be at home and you can come to university each day, well, this is just not possible in a hotel setting because we depend on guests' physical presence for revenue, which is hugely disrupted by the virus. But thankfully, health officials around the world have made significant strides in combating this invisible enemy, with vaccine doses currently getting administered to the public. Now, despite the go-ahead to resume operations, most hotels struggle to stay open, mainly due to the demands and tight competition. There are several strategies and action plans that we had to implement to be able to restart our business. That includes COVID-19 protocols, marketing. Do we know who our new normal guests are? And staffing, which has been very important. Now, COVID-19 protocols can be a big hurdle when reopening. It can be difficult to come up with the standards when you are not sure if they are correct or not, because none of us are experts when it comes to this pandemic. This is where industry experts come in, and the cost of this can be high when seeking advice. It is in your best interest that you abide by all government guidelines on reopening businesses in your province to protect yourself and guests and avoid getting in trouble with the law. Implementing safety measures like social distancing and cashless transactions goes a long way with keeping people in your hotel safe. In particular, social distancing, maintaining a 1.5 meter space between you and the next person, is critical in the hotel business since it experiences a lot of human traffic. To implement these protocols, you need to acquire the right tools such as wall and floor signs, access controls, contactless temperature checks, phone apps, wearable devices, and other things like this. All protocols need to be displayed in public areas, and guest rooms need to help guests concentrate on the critical steps for enhancing safety and health. Now, speaking of guest safety and health, it's critical to get a stockpile of sanitizers, masks, contactless temperature checking equipment, cleaning equipment, and gloves before reopening your hotel. And again, this is all expensive because it's something you never had to budget for in the past. Air conditioning services may also be beneficial in preventing infection spread. Leading experts say changes to building operations, including the operation of heating, ventilators, and air conditioning systems, can reduce airborne exposure. And of course, this all comes with a big price tag, and it could be expensive for a hotel that hasn't earned a single Thai baht in well over a year. For example, at my resort, we invested in experts from Crystal International Standards to help us put together our health and safety guidelines for our resort. The consultation fee alone costs us $3,000. Now, I mentioned marketing as the next one. Now, I mentioned that the hotel business has experienced low demand, so the competition is very high since many have reopened at once. So the only way to set your property apart from the competition is by focusing on marketing it. But remember, times have changed, hence you need to make a new marketing action plan with relevant updated strategies that all cost money. For the best results, your action plans should revolve around the following factors: updating your websites, Google, Facebook, Instagram, and all these other relevant social media outlets. Have a communication strategy and ensure that it's entertaining and valuable content that guests will love. Do we know who our new normal guests are? Because with this new pandemic, the guest model has changed. The pandemic changed everything, and you'll need to think of ways of attracting new guests when reopening our hotel. Whether you used to target business executives or catered for leisure travelers pre-COVID, it doesn't matter anymore. The critical thing is that you need to find new guests to ensure business continuity and stay atop of the competition. Staffing. With the pandemic, we had to lay off up to 75% of our staff. It was not a pleasant experience, but in order for the business to survive, this is what needed to be done. However, as we start to reopen again, staff are needed, even if we do not have any guests, and this can be a huge cost on the business. Salaries must be paid each month, but we have no income. So finding a balance is critical. Now, something that was in the notes when I spoke about it was in relation to the Phuket Sandbox. And the Phuket Sandbox has been a great opportunity for hotels to start to earn an income again. So has the Phuket Sandbox been a success? There are three ways to judge if the Sandbox was a success, in my opinion. First, the actual numbers versus what the Tourism Authority of Thailand projected, the income earned in the local economy, and then I guess understanding the virus behavior in vaccinated tourists. The Phuket Sandbox was scheduled to run from July 1 to September 30th. It was a 3-month deal. As of the 30th of September 2021, Phuket had welcomed 38,289 visitors to its shores. However, the TAT had initially projected 129,000 visitors. It then revised it down again just before the Sandbox started to 100,000, which is well short of what was projected. So on item 1, we would say, based solely on the numbers, it was not a success. Because in any business, your projected versus your budget would determine success in that way. Now, in relation to income earned, as of mid-September, because it's hard to find actual figures on this, they had generated 1.6 million Thai baht, which is a big achievement. And this income kept businesses afloat and salaries paid. In this regard, it would have to be considered a success, if just a modest one. And finally, and possibly the most important of the three, the Thai authorities learned through the Sandbox program that vaccinated international travelers pose little to no threat to the Thai population, with 0.3% testing positive in the first 3 months of the program. This information was used to condone the reduction of the mandatory 14 days on the island to just 7, and now the quarantine free that will start on November 1. At the same time, they reopened Samui. Now, I think the effort put in by the authorities along with local businesses just didn't pay off. As of the 23rd of October, Samui had only welcomed 1,737 travelers since the beginning on July 15th. And it's hard to consider that any kind of success. It's come to the point that Bangkok Airways ceased their flights from Bangkok to Samui because the numbers were simply not there. Now, we have the reopening of Hua Hin, which will be starting in the next few days. And this is at an interesting stage. This is an area that Hua Hin is an area that does not rely on international tourism, but more so relies on Thai domestic tourism, with up to 75% of visitors coming from within Thailand. So there has been a hesitancy from the authorities in Hua Hin to open to international tourism for fear of losing the very good trade that already they have been receiving domestically. However, if they keep the entry restrictions to Hua Hin simple, such as a vaccination certificate or a rapid antigen test for domestic travelers alone, there shouldn't be too much of a loss in relation to this area. It is worth noting that the reopening of the border to international tourism may be a fear factor from the local population in relation to spreading of the COVID-19, and they may deter some domestic tourists from traveling to the area. Now, the current direction of the country and where the government is heading, starting on November 1, which is only 3 days away, Thailand will reopen to international tours from 46 low-risk countries as designated by the Ministry of Foreign Affairs and the Ministry of Public Health. The new entry system will no longer rely on the certificate of entry, but rather on a new mechanism known as the Thailand Pass. Passengers are required to upload a copy of their passport, their vaccination certificate, their travel insurance policy, and a mandatory first night stay in an approved hotel known as an SHA Plus hotel. On arrival in Thailand, passengers will be screened at the airport and then taken to a swab hub where they will do a PCR test. They will then be taken to their hotel and they must stay there for the first night while they're waiting for their test results. If the result is negative, and the international traveller is then released and is free to travel anywhere within Thailand. And this will be the new policy for the country starting from November 1st, and hopefully it will encourage more tourism, more visitors to Thailand. Now, in relation to this phase of the reopening, I am definitely fully behind it, as I see it as a step forward for the country and in turn a step forward for Thai citizens and businesses to start to generate income within the country and start earning a living once again. If there was one thing that I would change, it would be to eliminate some of the bureaucracy that seems to get caught up with tourists, in which it seems needless and not necessary, such as reproducing all the documents that were approved in their home country prior to departure and arrival, again at the Thai airport. It's always worth noting that tourists travel to Thailand to enjoy themselves and relax and unwind. When designing any process, this should be kept in mind and be the forefront of decision making. Now, what should students studying tourism keep in mind moving forward? If there was one bit of advice as being a hotel manager that I would give any student studying tourism right now, it would be to keep in mind that the industry will always be evolving and continuously changing. And as a hospitality professional, it's up to you to educate yourself on best practice and to evolve with the business. Read, study, ask questions and research. And by doing this, you will definitely become a leader in your field. In relation to what policymakers should keep in mind moving forward, if there was one bit of advice that I would give to the policymakers behind the entry programs into Thailand, it would be to remember that tourism travel is for all and not just a select few. Remember, tourism and travel is about fun and exploring places that you go to. And when you create a process, keep in mind and try to keep the tourist and the traveler as much out of your bureaucracy as possible. By doing this, you will create a positive image of the country, and people will be more inclined to recommend it to the family and friends, and this will have a knock-on effect for tourism numbers for years to come. And that's it for now.
Okay, วิทยา
ค่ะ. I just have one question, just
Sure.
curious. When you said you were responsible for the vaccine tourism, right? Are you based in Thailand for the outside tourists to come in Thailand, or just people in Thailand just go for vaccine outside the country?
Say that one more time.
When you said you work about the vaccine tourism, do you mean vaccine tourism in Thailand, or for people in Thailand to go get vaccine outside the country?
For people to go get vaccines outside the country. I run hotels in Thailand, but I'm just speaking about my experience within that field.
Oh, that's why you talk about Phuket Sandbox, right?
Correct.
Oh, thank you.
Irada ค่ะ
Okay, hi, Mr. McNeil. I'm wondering about, do you know that you say that Thailand is not the good vaccine tourism because there's a shortage of the supply of the vaccine, right? But if we have enough supplies, do you think that Thailand is suitable to be the a vaccine tourist destination? Do you think that other people will get Thai people to get infected, and the number of infection will get higher and higher?
So,
Yes.
well, firstly, in relation to Thailand becoming a vaccine tourism destination, if Thailand has enough vaccines, then you'd have to make the presumption that many other countries at this point would have many vaccines, you know? So I don't see it as being a sustainable business in the future. Eventually, people are all going to, most countries are going to have the vaccine. If you see the way it's being produced right now, every country is getting supply now. So that's not going to be a huge issue. But if you're talking about them people coming to Thailand and infecting Thai people, I think the numbers, if you look at the numbers from vaccinated people who've arrived so far, the number who are infected is very, very low. And then you also have to ask yourself, because the numbers in Phuket, and it's hard to understand these numbers because they're not specific about the numbers. They don't say, were they infected when they arrived, or did they test positive on the 5th day or on the 12th day when they were doing this. So you don't know if they actually got infected when they were in Thailand, or was the infection brought in at the same time, you know? But we also have to come to the conclusion that eventually we can't live in fear of the virus either, you know? Otherwise our lives will be just all stagnated in fear of being infected by something. If we get vaccinated and we always take precautions, you know, then I don't think it's going to be such a big problem in the future. But the main thing is to be vaccinated and, you know, to continue doing the things we do. You know, when we go out, we wear our mask, we wash our hands, we try to, you know, keep our distance from people when we go to, you know, big shopping center and places like this. But I don't think it's going to be a huge problem as long as everybody, you know, plays their part, I think.
Vichaya.
I have one more question about the staffing that you said that like it's quite sad that you have to lay off like when the pandemic occur, and after the reopening you have to like recruit some of them. I just wanna know about the proportion, like about like people you lay off and people you have recruit, like the proportion of them. Is it like quite the same?
Yeah, I understand. So when, for example, one of my hotels, we've approximately, before the pandemic, we employed maybe 300 people. And last April of last year, when let's not say April, let's say May or June, because nobody really knew, we laid off about 225 people. So that's a lot of people. So, but we cannot rehire them again in that kind of ratio because it's just not, there's no guests. So you have to do it on it. So we've had to revise our staff budgets within our hotel to kind of focus on having less staff, but still doing the same amount of work until it comes to the point that tourism returns, and then we can start to rehire probably similar amount of staff that we had in the past. But right now, for example, I'm here today at the hotel and we have no guests. So, you know, but I have 30 staff here. So, you know, it's not easy, but you have to find a balance between it.
And just to add to that, I was in Phuket just now. I just got back from the US. I was in Le Méridien for a little bit, and I talked to the locals there. And the local hotels, everybody was laying off 50, 60, 70% of their staff as well, all over. And even the ones that were reopening, that were kind of hiring people back to get ready for the Phuket Sandbox, there wasn't, let's just say that the number of tourists coming in also wasn't as high as they were expecting. And so the cost of actually opening up a hotel again was actually a little bit higher than they were expecting compared to what they were getting in terms of the guests coming in. And so it was quite rough.
And just to add to that, we at the moment cannot hire back staff on a full-time basis. So like many, many hotels in this area, most staff are being hired back to work 15 days and then they're off for 15 days. So they're actually being paid half a month's salary. And this is very, very common in in this area where I am now, and even in Phuket, many people are still on, half salaries. Even many people have taken 6 months off to get, Social Security payments, because the payment from the government was actually more than they would make in the hotel. So, but they could get this for 6 months. But, we've had the best way to describe this. We've had a deal with our staff that if they did go on Social Security, that we would take them back when they came back, So they kind of supported the business by taking leave for 6 months and then coming back, to work here again. But it's still not on a full-time basis. But we're hoping November 1 that our housekeeping staff, for example, and our maintenance staff will begin to come back on a full-time basis. And then we will bring the rest of our staff back on December 1 when we start to see return of bookings on a full-time basis. But it won't be to the numbers of 300 staff in the hotel. Probably until, I'd say it'll be a good return maybe by high season next year, not high season this year.
Okay, thanks for the answer.
Panuwat.
Yes, I may have a few questions. As you mentioned that the quarantine cost for the hotel is very high, right? So, are there any ways to reduce this cost and make the guests enjoy their stay?
It depends on so my hotels here, the cost of the hotel set. For example, when people arrive to stay, in Phuket, the cost is right now, it varies from hotel to hotel. Some hotels can be quite cheap. Actually, you can find a lot of good 5-star hotels that are selling at 3-star prices. And that then pushes the 3-star hotel to the side and nobody will stay in them again, And this is really what's happened in Phuket a lot, is that you've had a lot of the really beautiful hotels in Phuket that are 5-star hotels who now start selling at 3-star prices. And then the 4- and 3-star hotels, they just sit empty. But they still try to hire back staff because they have an anticipation that they're going to have guests. But if you're a 3- or 4-star hotel, you can't reduce your price much more than you've already reduced it, because you're at the bottom anyway, you're at the bottom level anyway. So to go down, how much do you sell for, 500 baht a night? I mean, you're not making any money then as a hotel. But the bigger hotels, they can get away with it because their costs are, their rates are inflated anyway. It's based on a star rating rather than maybe the service. I mean, you can go to some hotels that are 3- and 4-star hotels that have better service than a 5-star hotel, but the prices are different because they've graded themselves as that,
Supakan.
Hello. I have a questions about the old strategy, the old business strategy that you say that couldn't apply anymore. Would you please set an example that the model that works? It could be like the marketing terms.
Well, for example, the business that I work in, we were firmly focused on international tourism. In actual fact, one of my hotels is a branded hotel by the largest travel agency in the world, which is known as TUI, and we're a franchise of them. And our model before that was completely international tourism, travel agency tourism. We actually didn't ever have to market anything. We had to do nothing. They sold us because we were a branded hotel, and they sold us full for 7 to 8 months a year, and they sold us 50% full for the rest of the year. So we had never anything to do. But when the pandemic started, when this all happened, and after the first 3 or 4 months when everywhere was closed and it was time to kind of try reopen again, it's very difficult for hotels to pivot from being solely focused on international tourism to try and focus on Thai domestic tourism. And what a lot of hotels now have realized is that you can't put all your eggs into this one basket. You can't say, I'm just going to be here for international tourists and forget about Thai people, because you need both. You have to have a mix. So this has been the strategy of marketing. I mean, my hotel group never used, Facebook or Instagram, or any marketing strategies when it came to domestic tourism, because they just simply, for that word, they didn't care. It didn't matter to them, But now, because tourism has, the international market has gone, the marketing department within the group have had to decide they've had to change. They've had to focus more on the Thai domestic tourism market, because otherwise you'll have nothing, right? So, but some hotels have been really good at this. They've learned very fast how to attract people through, kind of savvy Facebook marketing, and they've known how to do it. But hotel groups, and it's a criticism I have of my own hotel group, is that, we never engaged with the Thai domestic market for so long. So this has been a big problem with a lot of hotels, not just my group. Many hotels have just focused too long on international, but now you're going to need the balance. You need to have domestic tourism and you need international if you want to survive. If you expect international tourism to save you right now, you'll be dead very quick.
Thank you for the answers.
No problem.
Okay, so we have the question from Sukanya. Sukanya, can you ask the question by yourself, please?
Okay, so like in your opinion, do you think that Phuket Sandbox is a good strategy? Because like, for me, it seemed like the situation is not getting better after the government launched this strategy.
You mean in relation to the tourist numbers? Do you mean like the number of people that came?
No, I mean like in the hotel industry, because like,
yeah. Okay. Well, the problem with the Phuket Sandbox was it's simple. It's just it's not appealing to tourists, So having to go through all this paperwork before you go and wait for certificates of entry from embassies, and then you have to get when at the beginning it was 3 PCR tests when you arrive in the country. That's not fun for anyone. Tourism is about enjoying yourself. So if you're the holiday maker and you want to come to Thailand, this is not fun for anyone, getting a nose swab, 3 times, and they're not pleasant, and being tracked all day long. People don't want that, especially when the people who come, maybe they come from Europe, and they want to travel within Europe. It's so easy. You don't have to do anything, Like an example I can give you is just, my parents, I'm from Ireland. So my parents were going to Portugal for, 3 weeks, and they've been fully vaccinated. And they were just flying to Portugal. And all they had to do was fill out an online form that didn't even ask for one piece of information to be uploaded, just to tell them where you were staying in Portugal, how long are you staying for. They got when they finished, I did it for them actually, but when they did it, you got a piece of paper with a QR code on it, and that was it. When you got to the airport, the immigration officer just scanned it, and that was it. They didn't have to show anything to go in. But all right, maybe I think they could be a little stricter in relation to maybe showing that you had a vaccine certificate. But of course, if you lie, you've broken the law. So that's the other thing too. But then to go back to my country on the way back, it was very similar. They didn't ask for you to upload anything. It was just, fill out the form. Are you vaccinated? What dates did you get vaccinated on? Put in the information. Now they can ask you when you get to the airport, can you show me your vaccination certificate? And they do that to people randomly, but they don't deter tourism because people want to travel. And I think that was the problem with the Phuket Sandbox model. It was too much, I mean, people don't want to be greeted at the airport and people in full PPE gear, like you're an alien after arriving off a ship or something. It's not a pleasant. I don't believe it's a pleasant experience for any tourist.
I have pictures and videos to show them as well, because I was just through the Phuket Sandbox, and it's exactly like that. It felt like coming off an alien ship.
Yeah, it's like you have Ebola or something, that there's everyone's scared of you, but there's nothing really too much to be scared of. We have to either believe the vaccines work or they don't. And if they don't work, what are we getting them for? So you have to kind of balance it from that way too. I mean, it's hard. Tourism is such a big part of the Thai economy that it needs to be, I think, handled a little bit better in relation to getting people here. But we have to say that it was a small step, but it allows for a bigger step now in the future. So that's a good thing, I guess.
Thank you for your answer.
No problem.
Okay, so from your opinion, in the next 3 days, we are more than ready, right?
No.
No, so that's a big no.
It's interesting because I think everything is still, it's very confusing. I just saw an interview with the Ministry of Foreign Affairs and the Tourism Authority of Thailand last night with Trunk Travel, which is a big travel agency. And the answers that were being given were not concrete answers. It's like they didn't have the answers to everything. And I mean, I just hope that they make it easy for people when they arrive. You know, that it's not like, it can't be like the Phuket sandbox still. So when people arrive, they need to feel like they're arriving to the warmth of old Thailand before, you know? Like, I understand that there has to be a certain amount of safety for people, and people will always be nervous about travel coming back, you know, because I guess we all remember how the virus came here in the first place because it came from abroad, right? Like in every country around the world, it came from abroad. But I think we have to trust that, as I said, that the virus works and that testing works. But yeah, I'm a little worried that things are still not decided, you know, with a lot of things. I mean, even basic things like how much the PCR test will cost. They haven't decided that yet. And it's meant to be a standard price for across the whole country. So everybody, you know, are treated fairly when it comes to the price of a PCR test. And that hasn't been decided as of last night. We're 3 days away, you know. And then there's a problem at the moment with people who are still trying to come and they're applying for their certificates of entry from abroad, and they can't access the PCR system now to, you know, make a booking because they've kind of shut it down. And it's really, we tried to make a booking for people who are coming on the 7th of November, and we cannot make a booking for them to get a PCR test in the system. It just says you just cannot do it. You know, so there's a lot of hitches still. And they need to make things crystal clear for people. That's why people always ask me, do you recommend people to come to Thailand, you know, in the first few weeks of November? And I say no. I say, wait, let the system, you know, develop itself. Let them work out all the problems that are in the system right now. And then kind of think about it December, because it'll take time for, you know, them to, you know, even approving the Thailand pass. This is all going to take time. It's all new. You know, so don't rush to jump straight to Thailand. Wait a little bit. Wait till everything is perfectly done and all the problems are ironed out. It should be okay then.
Thank you. So Patra, would you like to ask a question?
Yes. Do you think like the change of the policy and the regulation have a huge impact on the vaccine tourism, and how like can they adapt with that? Like in case of United States, before like many months ago, many of tourists come to that country for a vaccine tourism, but recently they just changed the policy that tourists have to like fully vaccinated. Do you think like it will
To
have
arrive in America?
Yes.
Ah, okay. Yeah, America changed their policy in that, but that was bound to happen eventually anyway, you know. I'm not sure. Yeah, I'm not sure how you could travel to America. I think, Konoho, you could travel to America if you had a visa, right?
Yes. Yes, and you
Okay.
didn't have to be vaccinated before, or when I went to get vaccinated over there. So, but you're right. They just changed the policy because of
Yeah.
Delta cases going up and everything else.
But and that was bound to happen eventually. And this is going to
Right.
happen around the world because, you know, as I said, I don't believe vaccine tourism is going to last too long. You know, it's a thing because it existed only because people have a desire or had a desire to get vaccinated quickly, and were worried that they couldn't get vaccinated, for example, here in Thailand. Like everybody. I mean, I even considered going home to get vaccinated at one point myself.
Right. And there was also a pent-up demand. There was a huge demand for travel because the world was closed. It was shut down for so long. So everybody wanted to travel. So countries that had access to vaccines, they used that as bait to bring people in, to bring money into the country. And so, yeah, they took advantage of it. There was an opportunity. It was there. They got it.
Yeah. But now Thailand doesn't need to really worry too much about that. At the moment, we see that, you know, I think it's 40% of people are fully vaccinated now. And I mean, there's an awful lot more that still have had a first dose. And there seems to be a lot of vaccines coming into the country now. You know, you see a lot of Pfizer has been ordered. And there's the private Moderna, which will arrive, I think, next month. So there's a lot of vaccines available in this country, and I don't think there'll be much need for anybody to travel abroad to get it very soon. And then, of course, next year there's apparently quite big orders as well for vaccines in this country. So, look, as I say, I just don't think it's going to be much of a thing for very much longer, because as every country starts to get vaccinated, starts to get up to the 70 or 80%, people don't need to travel anymore to get vaccines. You know, you can get it at home, and it'll eventually come to the point where you'll be able to easily get a vaccine, and in Thailand too, because they're just going to have enough vaccine that, you know, even in my own country, which is a small country of 5 million people, at the beginning, yes, everybody wanted a vaccine. Everybody wanted one, but everyone had to wait. And they had a system for it, and it went according to how old you were and how sick you were. So the oldest people in society, the most vulnerable, they started off first getting the vaccine. And people, because it makes sense that older people are more vulnerable than younger people. So, you know, teenagers are not vulnerable to COVID-19 as an 85-year-old, you know, grandmother, you know. So yeah, as it went down, and now in my own country, you can walk into a pharmacy and you can get injected today if you want. So after they had it all done, it became to the point they had so much vaccine in the country that now we donate our vaccines across the world because we have so much, but we still keep a good bit of it. But you can walk into any pharmacy in my country today and get vaccinated. Every day they have what they call pop-up vaccine centers for people who've not been vaccinated. If you want, they'll announce today at between this time and this time, we'll have a vaccine center over here. We'll have another one this part of the country. Just come down. You don't need to. Anybody can get vaccinated in my country as well. It's not a thing that they discriminate who it is. Anybody, even a tourist. And it's not vaccine tourism in Ireland. People don't go to Ireland for vaccine tourism. But you can get vaccinated if you're not. Even if you're on holiday, as long as you can prove that you're living somewhere in a hotel, it doesn't matter. They'll vaccinate anybody, and that's really the way it should be, I guess. But yeah, to answer your question, I just think vaccine tourism will end, or it probably will come to an end shortly.
Okay, and you also mentioned about the new normal guest.
I haven't had any guests yet, so I don't know who the guest
Have
is.
you got the prototype in your head now? So
I think people who are willing to listen to rules and follow, you know, procedures and people like that. Some of my customers from before, I don't think will be returning, but you know, it's right now you have to look for people who are willing to put themselves through rules and regulations and having to follow certain things, you know. For example, Europeans are not great on wearing masks, which is a big problem. So you know, when people come here, and I get asked this all the time, do I have to wear a mask when I come to Thailand? I said, yes, you have to wear a mask. That's how it's done here. You wear a mask. How about if I go outside, wear a mask? I mean, you know, it's not the end of the world, you know. Sometimes I forget I even have my mask on half the time, you know. I've gotten kind of, when I first started wearing it, I had problems breathing with it. But, you know, after a while, you get used to it. But no, the new normal guest, I'm hoping it'll be people who are prepared to listen to rules and follow the regulations that hotels set, because if they don't, it's going to make it a very difficult work environment, you know. But we will eventually find those new normal guests. When I get some, I'm hoping next month. We'll see.
have you got any reservations yet?
I have so let's see, November is really quiet, but after like mid-December onwards, we have about 30-40% occupancy, which is okay from having nothing. And that's all from abroad. So that's all from Germany. My biggest markets are Germany, UK, and Nordic countries. So Sweden and Norway and Finland. So yeah, we have a lot of bookings, about 40%. And if the Thailand Pass goes well and there's a good kind of feedback, you know, from that, I think we'll get more bookings, but maybe not till January, February, March. I think demand is there from people, you know, like a lot of people seem to think that maybe, oh, you know, people the last year or so, that people in Europe maybe don't have money to travel, or, But this actually is just not true. I think people have more money to travel right now than they had a year ago. So for most people, like for example, in my country, in many countries, people have been paid by their governments to stay at home. So they've worked for, they've been paid to sit in their home. Banks have, they haven't had to pay mortgages. They haven't had to pay car repayments. So they've been getting, let's say 20,000 baht a week from the government to sit at home. They've had no bills to pay. I know people who've made profits during the pandemic from the government. And many, you even look in America right now, people don't want to go back to work. There's a shortage of people to work in America right now because the government have given them so much money that they prefer to stay at home than go to work. My uncle owns a bar restaurant in Chicago, and he can't find staff anymore. Some days he closes on Monday and Tuesdays because he has nobody to open to work in his bar and restaurant. Nobody. And he said, and it's all because a lot of people just prefer to stay at home right now. And that's the truth. Even in my own country, the hospitality industry has a huge shortage of people because they've been, they got paid a lot of money some of them were getting more money from the government than they would have got if they had worked. So people have money to travel, an awful lot of people. I remember people didn't just stop working in Europe. They've all been working from home, but with less expense. So they sit at home, they work on their computer all day, they do some Zoom calls, and they have no travel expenses, they have no gasoline expenses. They don't really have to worry about going out for lunch because you couldn't go out anywhere. So people have money to travel, and I think we're probably going to see a lot of that next year. I think people are still a little skeptical about going away at the moment, a little bit of a fear in traveling and where you're going to, but I think it will come back. Eventually it will, but it takes time. It's not going to be open the gates and it's going to be loads of people coming. It's not going to happen like that.
Thank you. Right. Thank you so much. Okay. Shall we have a quick break, then we come back to คุณโอโห
ได้ค่ะ
Sure.
Okay, so we come back at 2 o'clock. Okay, thank you.